We can start now.
Assalamu alaikum, everyone, and a warm welcome to today's webinar, The Future of Health Tech, Entrepreneurship as a Catalyst for Transformation. I am Mahmoud Adil, Global Clinical Data and Digital Health Lead for Royal College of
We can
Physicians.
start now.
Should I start now? Assalamu alaikum, everyone, and a warm welcome to today's webinar, The Future of Health Tech, Entrepreneurship as a Catalyst for Transformation. I am Mahmoud Adil, a global clinical data and digital health lead for the Royal College of Physicians of Edinburgh, former medical director, Public Health Scotland, and clinical professor of healthcare innovation in Qatar and former advisor to the Minister of Health of Qatar. And I'm moderating of this insightful session today. Well, I'm delighted to host this discussion under the umbrella of ICCD Leadership Talks, a platform dedicated to exploring innovative strategies for a prosperous and sustainable economic future in the Islamic world and beyond. When we use the word ICCD, it stands for Islamic Chamber of Commerce and Development, an organization which represents the private sector of 57 countries or 67, including affiliates through their federations and chambers of commerce. It promotes cooperation in the areas of trade, industry, and IT, as well as enhancing investment opportunities and entrepreneurship. So let me welcome the audience because you are our global audience joining from across the time zones, whether it is morning, afternoon, or night, where you are. Thank you for being here or watching this recording afterwards. You are the leaders and change maker on the ground. Your views and questions would be key to enrich this webinar. Please put your questions and comments in the chat, and we will deal with it at the end. But let me start with why this topic. It is a privilege to explore this topic because it touches every human being of over 7.5 billion population on Earth. That is health. And there are number of health challenges being faced, doesn't matter which country we talk about. And these challenges touches the health system of that country. For example, chronic diseases. Over 75% of mortality across the globe are because of chronic diseases. Infectious diseases, we have seen COVID-19. Elderly population, in particular in the Europe and developed world, there are almost 19% of the population is over the age of 65, and they have their own challenges. Workforce shortage with the right skills, new technologies and drugs which are increasing the cost of the health system. And then the waste and variation, because all the health systems and the organizations, they are not delivering to the best of their potential. And there's a lot of waste. And you can see the variation, huge variation between the best organization and the worst organization. And very, very important health inequalities. The people who need the most, they are getting the less. So we are keen to explore how entrepreneurship is reshaping the future of healthcare at a speed and at a scale by utilizing technology. So, as I said, entrepreneurship play a crucial role in health innovation. They are not just changing how healthcare is delivered, they are unlocking remarkable growth opportunities within the health tech sector. Therefore, I say the entrepreneurs are not just disruptors, they are enablers of transformation. They take risks for a positive impact on communities. And then if you look at all the key factors which are essential for entrepreneurship, but let me start, what is entrepreneurship? Because we need to be on the common definition, common grounds. Entrepreneurship is the ability to develop, organize, and run a business enterprise with an aim to create value for the enterprise and value for the society. Apart from capital, the most important factors are skills. Data skills, digital skills, leadership skills, and management skills, and utilizing the right technology to innovate. And talking about innovation, I am being part and parcel of the healthcare innovation ecosystem for a number of years. And I could see should be a systematic practice of developing and marketing breakthrough solutions for adoption by customers and create value for society. So you need to know a problem. I already alluded 4 or 5 big problems in the world on healthcare front. Then if you know the solutions, and then you need to have a business model to deliver that solution. So thinking about that, we have got excellent line of speakers or panelists who are going to shed light on the subject. So our first speaker is Dr. Zakiuddin Ahmed, founder and coach at the Institute of Innovation Leadership in Medicine and Management in Pakistan. He is a leader in the health tech industry and transforming health sector with wide expertise and dedication, in particular inspiring countless professionals to elevate their impact on patient care. Our second speaker is Dr. Osama Al Hassan. He's the chairperson of ZIMAM and specialist health informatics and smart health department at Dubai Health Authority. He's a key leader in the areas of digital health and talent development. His work in academic and governmental institutes across the UAE has shaped policies and robust regulatory framework that supported the transformation of healthcare in the country and beyond. And then last but not least, our third panelist, Mr. Rado Andrian, Head of Global AI Program at Health AI, the global agency for responsible AI in health based in Geneva. With over 20 years of experience driving digital change in healthcare and life sciences, Mr. Rado is leading voice in shaping ethical, responsible AI practices that serves both people and progress. So without further ado, let me start with Zaki. How would you see the transformative role and value of the health tech sector to our communities and a leadership perspective on this? Zaki, over to you.
Thank you very much. First of all, I would like to thank the organizers for giving me the opportunity. It's really good to be here with old friends and talk about something which has been close to my heart for well over nearly 3 decades now. So I think this is a very loaded question for me at least, and I will try to address it in a way as I understand it. So I've always taken health tech or telemedicine, whatever we call it, in a way that health is actually the most important part of that, whether it's digital health. So our focus should be on health as opposed to mostly on technology, which definitely we should consider as a tool and a facilitator. So the focus should be health, and that's why we exist. We also need to understand that healthcare today is unsafe, it's expensive, it's inaccessible, inefficient, ineffective. And I'll give you a few examples. So for instance, we have this preventable medical errors to a tune of WHO says that 10% of the patients are harmed while in the hospitals. And unfortunately, the numbers for our region is around 20 to 30%. We all know about the antibiotic resistance, the physician burnout. Physicians in the US commit suicide to a number of more than 400 per year. And we know what's happening in UK. Chronic diseases, all of the chronic diseases are on the rise, and we know the numbers. These are embarrassing numbers. Every year, the numbers go up. We are still struggling with universal access, and a lot of countries and a lot of regions and a lot of patients do not have universal access to healthcare. And last but not the least is the cost of healthcare, which has reached more than $8.5 trillion. So it's very expensive, it's very inefficient. Also, my submission would be that I would want all of us to think about the current medical system as essentially a sick care system. So it's not a healthcare system today. It's a sick care system which essentially reacts to something. When something happens, that's when the sick care system comes into play, and mainly managing illness rather than eradicating diseases. And hence, all the chronic diseases are on the rise, despite the wonder drugs, numerous research studies, all the big tertiary care centers, professors in different, specialty areas, despite all of that. So that's, the basis of my, narrative. I also know that throughout history, technology had transformed medicine, and we have witnessed ourselves how recent technological advancements have disrupted healthcare in unprecedented ways. So, as healthcare leaders, we should have a clear mission and vision based on the strong why. So I'm a why person, and that's why I teach leadership. Why we work in healthcare? Why do all of us as healthcare professionals exist? And the raison d'être is to serve the patient in a patient-centric, effective, and proactive healthcare system, which is accessible to everyone. So in order to achieve this vision, I believe that we need to invest in the development of our healthcare professionals in leadership qualities and skills and entrepreneurship, so that we are able to utilize technology, develop technology, and utilize technology efficiently.
Thank you, Zaki. I think it's a very excellent way to say that we need to emphasize on health rather than technology. And you alluded very well all the challenges which are being faced. In very brief, in last 30 seconds, any example where you have seen, in particular, I think you talked about the errors, right? And you said it is very high in the part of the world you live in. Any technology intervention which you have seen very effective, which is coming from a startup, but in few seconds now, because I have to move on to the next question.
Yeah. So we work a lot in patient safety. We organize conferences, and that's why we come to know what's happening globally. And the last conference which you organized, the theme of that was actually technology in patient safety. And we saw a lot of startups coming up with these, value-added solutions through which we could reduce infections, we could reduce these preventable, and that's why we call them preventable, because we can actually prevent these. So there were some systems through which we could decrease the infections in ICUs based on technology. I think the recent AI scribing is a perfect example where we are helping physicians rather than focusing on the computer screen, missing out on important conversation with the patient, missing out on the face to face, this the empathy. I think the AI scribe technology, which is I think disrupting this model, is one
Excellent.
of the examples.
Zaki, fine. We will talk about AI. I think you have, I think, well pointed that AI and all the key safety challenges for inpatient falls and infections and the DVTs. Right. Now, let me move on to Osama. Osama, well, I have observed all the great things being happened at your part of the world, and you played some key part. Could you share your perspective on the importance of health tech sector in the light of fundamental shift of healthcare delivery today? And there is a big shift happening in the UAE and, of course, in the Gulf region. Over to you, Osama.
Thank you very much. Assalamu alaikum, everyone. So I think this is a very good question. So if you see what's happening today, I'm not talking only about UAE, but generally speaking, because there's a huge shift from the classical healthcare system that used to have, which was kind of like provider-led or provider-centric, sometimes paper-based, and focusing also in-person connections between clinicians and patients. Looking into more reactive approach, as mentioned in the previous section. Now we are moving into more of proactive, more into adding technologies like virtual care and AI, trying to utilize more and more data. And even today, if someone asks me who would really get more insights in my data, whether my hospital or my Walmart. So Walmart today is actually utilizing my data in a better and more actionable way. So I think that healthcare need to catch up on this. So that's a very important part. If you recall, maybe 20 years ago or maybe more, most of the digital transformation was focusing on digitizing medical records. That was the main focus. And then they started to build some sort of ancillaries and then vertical solution. They were more into the enterprise level. We had very, very few intervention that comes from the ecosystem level. What happened now that we are no longer talking about mere digital transformation. Now we are talking what we call digital interventions. So that means that any transformation today has to be connected with some sort of outcome. and this outcome that has an impact. So this impact could be either on access, it could be either on improving outcomes, improving patient safety. That's a very important part. So we came to a next generation when we saw some of those interventions, especially at the ecosystem level. So in the last maybe 10, 15 years, I'm talking about GCC countries, we saw some what we call them interventions like a health information exchange, like e-claim clearing houses. Now we are seeing more things, more innovations or more intervention at the ecosystem level. And now I think we are coming to what we call the third generation of digital transformation today, that we need to build a kind of useful use cases, useful value-based intervention, which will really take healthcare and healthcare data to the next level, talking about social care, for example, how to social care can utilize the data that comes from healthcare. That could be also another area, talking about how healthcare can support the well-being and the preventive part of. So rather than focusing on curing patients, even predicting, looking into screening, looking into supporting population health, that's now becoming a kind of a new investments happening in digital health. And I believe that entrepreneurs should be focusing on building those value-based cases on top of the digital public health or digital public infrastructure that we are building, and also the infrastructure that we develop across the ecosystem. So that's what in a nutshell, what I can see. Change is happening because of the introduction of new technologies like AI, like virtual care, like building ecosystem level intervention that can really develop a lot of data that can be utilized through their insights to develop some sort of actionable intervention that can help patients at both individual level and population level. Thank you.
Thank you. Thank you, Sama. I think it was your slip of tongue, but was the right slip of tongue. You used the word digital population health. And I think that is the direction of travel, because 2 weeks ago, the UK government published its 10-year health plan. And of course, I always say that I think there are a few very good health systems which are equitable. NHS is one of those. And one of the things they're putting in there is that we need to move from hospital to community and population. And I think in the Middle East, where we can see that diabetes is prevalent and diabetes shouldn't be treated in the hospital. And I just to add what you kindly said very well, that when I was in medical school, there were only 3 types of services: primary care, secondary care, and tertiary care. Now we have invented a new term, pre-primary care, or the digital front door. So the patient, before it hits the system, which is the formal system, it needs to be using the digital means. And that is where the entrepreneurship comes into play. So let me move on to my third question to Rado. This is, how is health AI supporting the development of trustworthy, ethical, and scalable health tech ecosystem? Let me say it again, because this is the areas which are challenging in health AI: trustworthy, ethical, and scalable. And by doing so, where do you see the greatest untapped opportunities for AI-driven innovations? So it will be wonderful to hear your views. Rado, you've been in this field for a while.
Yeah, thank you for having me in this discussion. It's a privilege to be among the you guys experts. Let me just start with the untapped opportunities. AI offers a really unseen opportunity to advance health and speed up drug discoveries, remapping health and care management. You just mentioned that. Structure today we can really get at the front door even before we go to primary care. And as you rightfully mentioned, Zaquidin, actually AI can redefine our ailing health system overall. So AI I would say, is an expert in a chip. It doesn't today, and hopefully it will not replace the experts. But in areas where there is a lack of expertise, AI can upskill the care provider. And you also mentioned about really population health. It can really empower the patient and the citizen that we all are by providing us the right information in the right time. On the other hand, in areas where resources are lacking, AI can really streamline and automate operations. But AI still represents major risks today, among which further exacerbating health disparities, misinforming users, or failing under real-world conditions. So this is where, as health AI organization, we just try to play a role because we cannot just see the future of AI shaped by the technology alone, but we need to really bring in the values, the voices, and the policies that guide its development and use. And that's really the core of our work, really on advocacy, on diplomacy, and really on implementation. So I'll dive a bit further on how we do it, but in a nutshell, today we really work with governments to really build frameworks and really anchor responsible AI governance and ethical principles. And we also work with policymakers, and at the heart, we work with innovators. We have a community of practice where we really put all the people who really want to bring AI forth in health, and really try to shape with them, address all the burning questions that everybody has around AI today, and try to really bring the solution, use the global guidelines, and really fine-tune them to local contexts. So,
Rado, thank you. I think it's a very good start. But
yeah.
let me get back to you on one thing. We use the word AI now almost like we know everything about AI. I mean, first defining AI, where the computer science meet with data, and then you can do things which you already alluded. But one of the things which I think by developing health information exchanges across the globe, we are collecting a lot of data. But the challenge comes that AI cannot do much without the data. That is where the ethical and the safe use of AI comes into play.
Yeah.
Tell me a little bit more, or shed a little bit more light, how to utilize the data where the public can trust the AI.
Hold on. Oh, sorry. That was a share screen. Yeah. So, computational methods, that's where I started 20 years ago. It was not called AI, but the AI exists since the 50s. But computational method, they use rule-based approaches, expert system. You really try to put in a chip some knowledge, and you could use mathematical formulas to really implement some logics, or you really had just if-then, computationally to really bring that intelligence into a software application. Today, with the development of AI, it's more based on inference. So you rely much more on the data you use. And this is where the challenge comes in, because in the old days, if you made a mistake, you could really track it back. But today, you really need to pay attention to the data you feed, because you can induce bias in the data. So if you only take a certain category of population, if you only take a subset of a disease, and you say, okay, look, I've made an AI, it's working, and you want to deploy it in context where that distribution is not what's happening in the hospital or in the country, you roll it out, then you risk to just create or further enhance some biases.
Excellent point. Because I was going to come back to this thing that nowadays, most of the development AI is happening on the Western Hemisphere. And this is where the challenge is, that health is a basic human right, and we need to be providing health in the equitable manner. But when we look at the AI algorithms, they are still being based on a particular population profile. And that is the way I see the webinar like this may motivate all of us across the globe, that we should be able to share the data. I was had the opportunity to lead and coordinate the health information exchanges and the data national functions back home in the UK. And one of the things we are keen to do is that how best we can ethically provide the data to the companies who are keen to bring the AI, and I use the word that with ethical and trustworthiness. But we'll come back to you later. Let me move on and move back to Zaki. Zaki, look, we it is important. I think you, mashallah, led the institute, and a lot of work has been done at the institute, which you are the founder. But can you share that what contributions it is promoting in health tech and the key challenges faced on this journey? Because it was a long journey. I'm sure you can talk a lot about contribution, but the audience might be keen to know what are the key challenges. Over to you.
Yeah, thank you. So, you know, again, with a backdrop of, why I got here and established this institute, which will be shown here. If we can have the slide, please. So while they put up the slide, so, I've been working in telemedicine for around 28 years now. So I started telemedicine at the outset of my career, and telemedicine was the reason that I gave up my clinical practice around 28 years ago, and entered into this space and started working in health systems and understanding healthcare and health systems. And during my own journey of this struggle, I realized that despite the fact that telemedicine was a too good to be true solution for patients, our physicians at that time not only did not accept or use telemedicine in their practices, but they resisted it strongly based on their biases or lack of understanding. Similarly, my journey of patient safety, which spans over 20 years, also taught me the same lesson that physicians, by and large, do not accept change easily, and they are change averse. Physicians are also trained, to work as individual champions as opposed to working in team. So this made me or encouraged me to work in this space. And I realized that in order for the physicians or healthcare professionals to adopt change and adapt to it and work as a team, they need to be trained in leadership and related areas. This is when I decided that I will help the physicians and HCPs, which we call healthcare professionals, to learn about change management, leadership, and different topics that I share in detail. So, Institute of Innovation Leadership was established to fulfill this need of capacity building of our healthcare professionals in leadership in our part of the world, especially our part of the world, as we see being done in the last 2 decades in the developed world through frameworks like CanMed from Canada, your own NHS, 9 modules, the Duke University model with the patient at the center, Harvard School program, and there are many others in pretty much all over the world. So these frameworks have focused on building the capacity of healthcare professionals in areas including leadership, communication, advocacy, collaboration, research, innovation, entrepreneurship, in addition for them being experts in their own fields. So in this
Zaki, can I just sorry to interject. You raised a very, very good point that, mashallah, you started the institute, you had a ethos, what was the reason on your personal journey. My question may be a challenge back to the health systems are, we need to change the basic curriculum of our healthcare workforce, whether they're doctors, whether nurses, rather than they should be coming at certain point to certain institute. So I think that is my reflection, what you said, and I like to have your reflection that what has been done in your part of the world to change the basic curriculum to add those fundamental things, which I say 3 new things: the quality paradigm, the management paradigm, and of course the digital health paradigm.
So yeah, thank you for actually asking this question, which is addressed here on the slide. So if you look at the models which I've created, so one of the models is called Scholar, and Scholar actually is the model which I am establishing in the medical schools and nursing schools and pharmacy schools across medical universities, whereby we are actually teaching them all of these areas. So we're teaching them safety, we're teaching them digital health, leadership. So all these, 5 areas, we are helping them to understand even before they graduate and become physicians or nurses or pharmacists or other professionals. So the answer to your question is that this institute, and again, based on the experience which I had and understanding healthcare, understanding physicians and professionals, I decided to have a multi-pronged strategy. So I help CEOs, professors, medical directors. I conduct trainings for them, and I also go as low as first year, second year, third year medical school or pharmacy school students, where we establish these scholars center of excellence to develop the 21st century healthcare professionals, as mentioned in the slide.
Thank you, Zaki. And again, I think knowledge and practice, skill and competencies, I think these are two different things. And I'm sure on your excellent way of intervening in the health system or academic side, you will help them to develop the competencies. Let me move on to now Osama. Osama, I think we are on this subject of building the workforce and the great work done by Zimam is, I mean, I've personally seen the journey of Zimam over the last few years. So I would like to ask you, how has Zimam contributed to the growth of health tech in the region? Because the ultimate goal is the workforce development, and the challenges faced in doing so. Because again, the challenges are keen. I think I was expecting from Zaki, but I will come back to Zaki about the challenges when I come back later. So over to you.
Thank you very much. So I just want to set the scene of the contribution of Zimam. So I want just to share the story of Zimam from the beginning with the audience. So I started my journey with digital health almost 20 years back. And through the years, I realized a very important insight that I've seen and I've witnessed many projects which actually either fully or partially fail, not because of the lack of investments, of infrastructure, or maybe the support from the government, but actually because of the lack of talents who really take these technologies and get the most out of it by improving them, by adding new functionalities. That was really tough thing. And I've seen a lot of leaders and managers coming from other domains, maybe banking, maybe security, maybe mobility, and they took some leading roles in digital health. And unfortunately, they try to copy their experience in these other domains to healthcare. And normally they fail, they miserably fail because, as I said, digital health has to have certain competencies related to the domain. And most of the decision makers and leaders were actually lacking this understanding that we need to professionalize digital health. We need to standardize and build competencies and skills, and then include them in even job description, career path, making sure that we provide the right incentives for the smart and talented people, not only to engage in digital health, but to stay in digital health. And that cannot be done without having incentives, career path, and on-the-job training, because digital health changes every day. So even if you have the best training, maybe in US or UK, and you can land into a job without the support in terms of on-the-job training and growth in terms of knowledge, you will be left behind. So that's the challenge. So that's why we came up with Zimam back in 2018. I joined a number of scholars from all GCC countries who shared the same vision, and we realized that we need to do something about that. We need to build the awareness about the importance of building competencies in digital health. We started with a very small scale gathering in 2018. We brought the community together, and we decided to focus on certain technologies to build sub-communities. So I give you one example for that. In 2018, we came up with a very specific workshop around health information exchange. We brought an expert from ONC in US to teach 12 people who attended this event how to develop HIEs and how to push the envelope, how to even convince decision makers on the importance of HIE. Those 12 people were actually the ambassadors of HIE across the region. When we had the same meeting back in November, last November, we had 400 people in the room and 5 HIEs up and running in the region. That's the way that Zimam does things, building communities and supporting education.
It's great. I was witness to that, and I can say that. Because I think the way you reflected from 12 to 400 and developing a community of ambassador, because I like the term ambassador, because this is something we need to be promoting, because these are the people who should be the champion at their own, rather than they should be fed. The other point you made, again, very valid to all of us and to people who are listening and also across the globe, that the digital health is moving every minute. And we cannot be done just by one course, but what Zaki has done, that he has initiated things as well, and basically sowing the seed in people's heart and mind that they should start their journey and then keep continuing learning. And that's what Zimam is doing. And thank you for shedding light, and your slide was also very helpful. Let me move on to my next question to Rado. Now, look, colleagues, both Zaki and Osama has really given good insight that what has happened on the Zimam front and the Institute of Innovation Leadership in Medicine and Management. But tell me that what are the major challenges faced by your organization that healthcare AI and while trying to foster and propel this crucial health tech sector? Because AI has been used in many sectors, right? And I always see, and I've seen over the years with my experience, that health sector is always lagging behind when it comes to innovation. So my question back to you is, again, let me rephrase, what are the major challenges faced by your organization while trying to foster and propel this crucial health tech sector?
Yes. So, well, basically, AI is like any new technology. There are the things you know, there are the things you don't know. And in the things you don't know, there are the things you know you don't know, and the things you don't know you don't know. And this is actually one of the key challenges, because how do you regulate that? How do you govern that beast? And I think this is what's quite critical today. And it doesn't take one entity, WHO, we have and OECD, we have global guidelines. I mean, it takes the whole world to just figure out how to do things. And I think that that's really kind of the critical aspect that we're facing now, and we try to address. And our organization is really the global agency for responsible AI in health. Global, as we really try to bring that global perspective. You mentioned about data as a challenge, really, universal data, so that we can develop AI that becomes more universal, more generalizable. But it's not just the only challenge that we need to address. It's also explainability. It's also validation, usability, and how we interpret, how we interact. How do you bring back the human in the loop? But when we talk about, regulations, one key question that often comes in mind, or one criticism, and this is maybe the biggest of our challenges, yeah, but when you put regulation, you just hamper innovation. But we, in the healthcare world, we need that regulation, because that's how we bring trust. Will you use a solution that hasn't been tested and approved, and then just you base your judgment, your clinical decision on a solution that hasn't been really tested and approved? You take a pill because you had clinical trials to show that you can take it safely. So we need that regulatory framework for AI, and we often talk about medical device, and it's already regulated, but anything that is not a medical device is not today. So how do we still build that governance of AI overall, and specifically in all these applications that are not regulated as software as medical device? How do we find that fringe where you need that level of regulation? So that's the biggest challenge, and how we address it today, really, for us, because our vision is is to really bring that future where AI produces equitable and inclusive improvement, is really to build the bridges between the global organizations and the national governments. Through our Pioneer program, we really help them strengthen their national capabilities. At the global level, we are building that global regulatory network, and we're also bringing the tools where you can have a central repository or directory of registered AI so that people can really see what's been developed where, and then have that early warning system to really realize what's working, what's not, what are the limitations. And we also bring the technical advisory on policies and regulations. So it's really the combination.
Rado, can I interject to ask one thing which is pertinent? Look, if you look at Europe, they have got AI regulation, the European Union passed that, right?
Yeah.
If you come to Dubai, UAE is a very good example. They have got a regulatory sandbox.
Yes.
If you look at other countries, they are in a different stage of maturity.
Yes.
Now, as health AI, could it be one-stop shop for people to go and see that what health regulations are in the pipeline? Because this is one of the challenges. I think I know relatively well, but I still feel that I am behind when it comes about changes in the regulatory side across the globe. The reason I'm saying it, because the health app, which is being developed in one part of the world, is going to be used globally because that is the strength of digital health. But
Yeah.
if the regulations are not matching this, then that will be challenged. So
Yeah.
if I am a policymaker sitting in some part of the world and I like to see what is in the pipeline, do you think health AI would be able to fill that gap of knowledge?
Exactly. I mean, again, we cannot do it alone, but we try to really, as I said, we work local. So really try to look at the global guidelines. And if I take the example of medical devices, you've got the IMDRF, global guidelines on medical device and specifically related to AI, it's going to be the software as medical device. These are global guidelines. But then you have how it's implemented in the US through the FDA, how it's implemented in Europe through the MDR, and how it's implemented in other territories. And the people who are still asking themselves, how do I understand the broad of what's required from me, then we help them. So we're building that navigator that really takes, starting from the global guidelines and then starting to build the specifics and the comparing, mapping the different regions and how they've implemented it, and then really help. And that's really our core. The core of our work is at the local level. What do you need and what do you want to start with? Because if you
Thank
need
you.
to wait for every country to just say, "Oh, I need to write the whole regulation before I can embrace AI," maybe it takes 10 years and you're lagging behind. So we really help them prioritize what are the first pieces of the legislation that they need to put in place.
Thank you, Rado, because one thing which is the digital inequality, because that's the last thing we want to happen across the globe, because health is a basic human right. And I think with the digital health, we can provide it quickly and at a scale across the globe, but we do not want to have that variation. And thank you for highlighting that health AI is filling that gap. So now I'm come to a very motivational question to each one of you. Let me go back to Zeki. Zeki, how you predict the future of health tech? It is a very open-ended question, right? And I think you can give me a jolly answer, you can give me a serious answer, but I think the prediction is everything. I remember what was the movie was famous on the series of the Back to Future. And if you look at that movie, you realize that what are the things he did is already happening. So I need prediction like that. So when people look back at this webinar, they say, oh, yes, these are the people who predicted something. So over to you, Zaki, and I think we have got about 3 minutes for you.
Okay. So yeah, the best way to predict the future is to create the future, as Abraham Lincoln said. So I think,
Good.
and again, I think AI has humbled all of us. So we can just, based on our previous experiences, we can try. But due to AI, I think we have to be very cautious. So we all know that, future of healthcare is digital health. That's what Dr. Tedros said, and that's what all of us believe. Healthcare is digital health now. So this means that digital technologies will drive healthcare in future. Uh, So we as healthcare leaders, we actually need to understand first how to develop and utilize technologies and the advancements, keeping in mind, the more empowered generations like millennials, the Z generation, and now Alpha and Beta in future. So even the Z generation will not accept the current healthcare system, which is very inefficient, let alone the Alpha and Beta. So in future, answer to your question is a little serious one. This is what I think. The future is going to be a connected and collaborative healthcare ecosystem created through metaverse, agentic AI, and wearable remote patient monitoring. So I will actually focus on these three areas: metaverse, agentic AI, and wearable remote patient monitoring. Focus around specific needs and preferences. I think that's the major key of people and patients, and I've used people deliberately with personalized human-centric approach to predict illness and create health and wellness. So I've kind of tried to summarize both technology side as well as the need and the trends in healthcare as we know the system. So hospitals, and this is not future, this is already the past, which I'm going to say. Hospitals will actually emerge into hospitals through this new ecosystem based on technology and desired patient needs and experiences. And patients will, in this futuristic metaverse, patients will remain connected with their healthcare professionals 24/7 through wearables or even insidables for continuous and seamless monitoring of their blood pressure. So I'm wearing a blood pressure monitor right now. And why this is not inflating? Because of artificial intelligence. So this is an FDA approved device, which is seamlessly, can be owned by any patient. So ECG, so we have an ECG, which we have integrated into our platform, blood sugar, oxygen saturation, respiratory rate, heart rate, blood chemicals, sleep parameters, movement patterns, fetal heart rate, type and quantity of food, the patients eat. All of this information is going to be conveyed within the metaverse and the connected health ecosystem. So that's what I predict.
Thank you, Zaki. It's a good prediction, but let me be more provocative, right? You use the word patient, right? I think we need to shift the paradigm from patient to public, because reason is that once you become a patient, it is too late for the health system. So
I actually used the word people, and I mentioned that I'm deliberately using people because of this reason which you have mentioned. So people and patients. So I've used both.
Very nice, because what I'm saying is that the then very rudimentary question: what will be the role of the doctors? Because this is the million-dollar question being asked everywhere. That we are putting a lot of emphasis, opening new medical schools, everything. Then what's the role of the doctors when the AI is there, good prediction is there, and everything is being done now on diagnosis-wise? So the last 40 seconds for you.
Yeah, sure. So, like I said, ever since I started working in telemedicine, I've been hearing this question. Dr. Ahmed, is telemedicine going to replace, physicians? We get this question more now because we talk about artificial intelligence. My answer to it is that, physicians need to redefine their role so that they're not replaced or they are not redundant in the AI environment. So every physician, if they want to remain in this ecosystem, have to develop themselves in strategic planning. That's where ILM comes in. Complex decision making rather than repetitive, pattern-based practices. Build trust, manage complex patient cases, and focus on ethical considerations. So redefining the role of the physician and healthcare provider, both in these areas, as well as learning digital technology and artificial intelligence, will help them not to be replaced.
Very good. I think you're spot on. One thing to add from my end, the empathy, no machine can replace the empathy of a human being, because the human touch, the patient or the public still need it, but I think you're spot on that they need to develop the new skills in order to be part of the ecosystem. Okay, Osama, the same question to you.
Thank you. Thank you very much. It's a really very difficult question. So actually, what I believe that in the future, I will say persons, I won't say patient, but person will be truly owning their data, because this is not happening today. My data, my healthcare data is locked within the facilities that I visit, with the doctors that I consult. If I want to take my data somewhere else or maybe across borders, that's a challenge. Tomorrow, my data, I'm not talking about the only healthcare data, but genomics data, biomarkers, data collected from devices. All these data will be homogenized together in a very effective way that allows me to get insights. And even it will help me through AI to judge or to reassess all the diagnoses or the kind of like advices that I got from the healthcare system. So I would be having the second chance to look to my holistic data in a very neutral way. So that's a very important part. I think even with regard to cross-border, so taking your data outside of your healthcare system, that will become much easier. And I'm seeing now like use cases like what, I don't know if you heard about the IBS for Hajj. So that's a very good use case that allow a patient to take his data to a different country for a certain context. I believe international patient summary will play a very important role in the future. Last but not the least, I think now when talking about data that will be fed to AI, that should be more now kind of domain specific. We want to see more of like clinical models that will be taking our data into a second level, which can be easily consumed by AI without going for hallucination or whatever. That working on the data structures and data models, especially the clinical one, will open up a lot of even use cases that we don't even can think about. So that's a very important part.
Thank you, Sam. I think you touched upon 2, 3 very pertinent points. I think the first thing you said, if I add and reflect back on that point, I think the patient will own their data. What we are doing, and I think we have done a lot in UK, and I'm pushing things in Middle East, is co-producing health. Because we need to co-produce health. The patient needs to own their health now. The only way you can own your own health, including you and me and others who are relatively literate people. But if I don't have the data in front of me, how do I know how much exercise I have done? So we need to move the national policies towards co-producing health. And then I think the international patient summary, you are spot on. The good example is European health data space. They're doing the Europe-wide. So the patient summary goes in the whole Europe, right? And I think Hajj is an excellent example. We have seen in a couple of countries who are already on board. I think UAE is coming on board. When the patient go for Hajj, then they have got the basic data, and we call it in UK the summary care record, and that record will be there. And I think your prediction, if I say, is very practical, is already here. But I think we all who are on this forum and who are listening, we need to work collectively on the data side, because the last but not least, which I see relatively missing in the Middle East part, but it's relatively good in Scandinavian country, is the data on broader determinants of health. Because that is the reason the Scandinavian countries are able to intervene, because they have got an excellent broader determinants of health data or social determinants, where you live, how much you are educated. And you know, the 60% of our health outcomes are based on those determinants, not having good hospital. So thank you for raising the point on data. So let's go to Rado. Rado, same question to you.
Yeah, I'd like to just come back a little bit. We talk about transformation and future, but if you look, 50 years, 70 years ago, medical imaging, that transformed medicine. When medical imaging came in, you could see through the body, and you didn't need to cut through the body to see something going wrong. That was really transformative. And medical imaging was also the first digital system that, it was healthcare 1.0 at that time. And you see how it really evolved and really reshaped how we treat people. And I would say that AI and the rest of technology now is really moving along that line. So I'm quite confident that it will come there, where the same way as medical imaging allowed us to be a bit more predictive, to be a bit more preventive, then with all the digital technologies today, we can really realize the 5P of medicine, which is really personalized, predictive, participative, preventive, and population-based. And that really touches, it's a simplified way to just summarize what everybody's been saying, because population-based is it's not just, patients, but really looking at the population, really looking at the evidence, but also engaging with the people. So patients are becoming, or citizens are becoming the CEOs of their health. But for that to happen, you need to change that healthcare system. And that's where we're talking more and more about value-based healthcare, where it's really co-ownership. I commit to manage my life so that I don't worsen my diabetes. And then the healthcare system really supports me, and the payers really split the bill on that so that I live healthier and longer. So I think this is coming, this is really becoming a reality, but it takes education. And we are not there yet because we are still on that paradigm of really pay per service. Bringing the technology that really shift that paradigm towards value-based healthcare is hard to come in. So I think that that's going to be the next battle. But having the data really takes it to the next level, because everything digital brings more objective measure. And I think that that's going to be the next element. But we need to educate every single individual. What does it mean? It's not just about the data, but the insights you get out of it. We have lots of sensors, but what do I do with 10 million data points if I don't have insight that are meaningful to me? So that's going to be the next chapter, really on interpreting and really giving that useful insights so that everybody is really empowered, not just the patients, as we enjoy talking about now, patient empowerment, but also the clinician and the rest.
Rado, I think you're right. I think I use the term health intelligence because the way we see things through the intelligence, which is about my own health, is going to change me to change, right?
Yeah.
So I just a supplementary question, maybe it's a one-line answer. With your experience, how the AI in healthcare as compared to other sectors, which other sector is making the biggest leap in utilizing the AI to create community benefit? One or two sectors apart from health?
Well, that's a tough question. It's hard to say, because the impact of AI at population level is, again, we are not at the point where we can mention it globally, because it's really lots of initiative and it's very Western world today. But overall, I mean, you could mention global safety, but it's not there completely yet.
Okay. No worries, Rado. I think this was just nudging you. But let me see that if our audience has asked any questions. Yes, I think we have got a couple of questions. And I will, without naming who has asked, let me see what the question is. So the question is that I concur that entrepreneurs are enablers of on the health front, but I feel they are the worst sufferers of bureaucracy, nepotism. So the question is that, okay, if there is any agency that can consider such a startup proposals, which would be beyond any sort of bureaucracy, and improving the health tech infrastructure. So I think, again, if I ask each one of you, because I am going to use this question as a sounding board, the question is that how we define a effective entrepreneur in the future, both from the government perspective as well as from entrepreneur perspective. Because if I'm an entrepreneur, I do not want to face any challenges in order to take my idea to the next level. And if you are a key policymaker, how would you like to define a successful entrepreneur in your country? So Zaki, should I start from you?
Yeah, sure. So I think that, entrepreneurs are the most resilient people there are. And if anyone, I'm an entrepreneur. I converted from, as I said, a clinician to an entrepreneur and in digital health. And I failed and failed and failed. So entrepreneurs, as we now say, we embrace failure, right? And we fail fast. And no startup exists which will not face challenges. And you will have bureaucracy. You will, and especially in our case, we have the health establishment.
I think we have lost Zaki. Should I come to Osama? Osama, Dubai has been very, very good on the startup front. And what is your experience that how a successful entrepreneur would be in the future if he or she is working in Dubai?
Okay, so let me speak a little bit about the government side as well. So
Okay.
we developed a lot of governance structure that allow this kind of engagement between private sector and the public sector. So even when we develop projects, such for example an HIE, as part of the strategy of developing the HIE by the government, we should look into how the private sector will support us. So even as part of the strategy of HIEs, we develop the idea of sandbox. So sandboxes, especially regulatory and innovation sandboxes, could be a way that can allow private sector startups, entrepreneur to engage with government infrastructure. That's kind of very good way to assess how private sector and entrepreneurs will connect with data sets that come from the government. And this will be kind of a free playground where we can identify and balance between the value of this integration and other regulatory aspects like privacy of cybersecurity, whatever. So building these kind of regulatory frameworks around sandboxes will be really a very good tool to activate these kind of cooperation between private sector and public sector. So putting into the strategies of the development of infrastructure, the idea of sandbox. Another way of doing things is marketplace. So connecting those infrastructures with a marketplace that can really be connected to through mobile apps. And these mobile apps can have access to certain data sets in a very secure way and provide some sort of added value services to patients, to providers, to other players in the ecosystem. So I believe that the role of government is more important to give the space to those entrepreneurship to get into those kind of solutions. Another way that's coming from the legal side as well is we need to build some sort of kind of like a way, business models, ways to help those entrepreneurs to engage with government. Like for example, building an efficiency-based program. So that will allow an entrepreneur to come with an idea, implement it, and if it succeeds one way or another, and it saves, for example, some money, some slash of this money should go back to the private sector as an incentive. So these
Very
kind
good.
of business models are very, very important to implement, and we are going into this direction as well.
No, I think this is, well, Zaki, I will come back to you because you wanted to conclude your point. But let me say, I think, Osama, what you suggested, I think we have seen a big wave of policy regulatory framework in that direction in the Middle East. Saudi is doing wonderful things on that front. UAE is happening. And I think in Qatar, the Web Summit is an excellent example that where the entrepreneurs from all over the world were coming. There are two happened, and I was there speaking or helping startups, and I could see that they are holding people's hand, both on the regulatory side, the legal side, and of course from the capital side. And I think this is the way we can motivate entrepreneurs to work in the health sector and the other thing is the availability of data. And I think the data and health sector, you said the Walmart has got used my data more than my own health system. This is something we need to be working on. Zaki, you wanted to conclude your point because I think due to some reasons there was technical hiccup, but you were making a good point before. You're on mute, Zaki.
Thank you very much. My perspective, as I wanted to say, is from an entrepreneurial side, and I agree with Sama that the government has to create that environment and a conducive and ecosystem, and those are brilliant points. Coming back to the entrepreneur, especially in healthcare, I believe that that entrepreneur has to be very passionate. The why has to be very clear. The approach should not be of a pilot, but more of a proof of concept leading to a startup and then scaling it. But what I understood from the question, I think this is going to be always a very difficult journey, especially in healthcare because of special prohibitions and trends in healthcare. So whoever wants to become an entrepreneur in healthcare, I think his or her why has to be corrected, and the passion has to be behind it, along with obviously looking at the trends and looking at the need rather than making it. The startup should not be technology driven. It should be looking at a problem, and it should be need based. So that's my 2 cents as an entrepreneur.
Thank you very much, Zaki. I think we have got one more question from the audience. It says, is the new sectors all about preventive care, such as nutrition, well-being? Are we closer to alternative therapies like homeopathy? Basically, the question is that AI is converging many areas of health together. Will we legally see the convergence? I think I can just quickly say, because of the mindful of time, I think all those alternative medicine therapies are having their legal recognition first, because if I take example of UK, certain of them already been approved over there and that's available. And then the next point come the convergence. So I think it is a very stepwise approach. We need to look around the globe that when we think about health, health is defined as physical, mental, and social well-being. And any intervention coming from any skill set, like mentioned by the questioner, the lady who asked the question, the gentleman who asked the question, it means that if you have got an intervention, irrespective of your background, then it needs to be looking at the regulatory side first, like homeopathy has been approved in the UK, and there are certain hospitals who are providing homeopathic services. But it means that they need to look at the evidence. God forbid anything goes wrong, who would be responsible? And I think that's applied to the number of other specialities. So I'm mindful of time, and I'm sure our audience have enjoyed, or whoever will watch later, they will enjoy this session. And my colleagues, Osama, Zaki, and Rado, they have done the wonderful job to give us a very good insight on the different perspective of this topic. So I think let me conclude by saying that health is wealth. And health is wealth in two ways, because if we can improve the health of a society, health of a city, health of a community, we are going to improve the GDP of that society, because the people are more active. And people might not know that one of the biggest health problem in many of the UK and many other countries, backache and stress. So if people go off work because of backache and stress, and if we can deal with that with our good idea of entrepreneurship, then it means we can improve the productivity. Other way to look at health is wealth is becoming an entrepreneur in the health sector, as the topic suggested. And it means that you can create value for yourself and you can create value for the society. But in order to do that, my colleague already said, but I can sum it up, you need to have the commitment, you need to have the creativity, you need to have a communication, and you need to have the capital. But most important, you need to have the skills. So I think the ideas which we generated in this webinar are going to be very useful in order for you people who are listening You are the leaders, and I define leader is when your actions inspire others to dream more, learn more, do more, and then you are a leader. And I think if you can do that, you can play that role wherever you are, then that is going to make a difference. Because if health tech is one of the key ways to improve the health of a nation, health of a person, or health of a patient, then I define that where code meet care, then it means we are using health technology in the best possible way. And the code means the data. And I think we discussed data in great length. And I'm sure that you are going to improve the actions of your work on the ground. And on that note, I would say thank you to ICCD to organizing this leadership webinar, and to my three wonderful speakers and panelists. They added value with their wealth of experience and knowledge. And thank you all.
Thank you.
Thank you.
Thank you. Walaikum salam. Thank you.
Isra, have you done the job?
Hello, Dr. Mahmoud.
Hello.
Thank you so much.
Right. I think thank you to everyone.